Those treatment instructions, they're super simple. Everybody goes home with an actual copy, so if you forget, you can refer back to your paper or the phone numbers here. You can always call us if you have questions. After the treatment, you're going to use any moisturizer of your choice. Today, I will actually put a topical on you, a moisturizer, and then also some sunscreen. But after you leave here, it's just your job to wash your face with a nice gentle soap. Nothing really aggressive, nothing with acids in it like salicylic acid or glycolic acid, nothing with retin A, so just something super gentle.
Okay.
Dove soap or our Phytomere face wash I love. It's all natural, so you're not getting those abrasive topicals in those. But whatever you want to use, you can use. So you want to do that for a week. After 1 week, you can go back to your normal routine, whatever you use. If you're a retin A user or Obagi, I know they have salicylic acid in their cleansers, so just wait a week. You're going to want to wear sunscreen when you're outside, especially important that first week, but we definitely want you using sunscreen for at least 3 weeks. Our recommendation that you're always using sunscreen. I think it's important too, that reapplication. A lot of times we think, I put on my sunscreen this morning and I'm good to go. If you're outside, it's every 90 minutes you're going to want to reapply. And you are going to be heat sensitive, so you're probably not really going to want to be out in the sun. So definitely hat, sunscreen, and multiple applications if you are. No tanning for 2 weeks, and that goes for tanning outside, tanning in tanning beds, or even topical like lotion tanners. You don't even want to do that.
Okay.
You can really hold on to that pigment in those little micro injection sites, and it's just not a good idea.
Right.
Pretty much, it's just easy peasy. You can wear makeup right away if you'd like to. I know personally I like to wait 24 hours. I just feel like we just cleaned the skin and opened all the stuff up, so I kind of just like to leave it alone for at least 24 hours and then go back to your regular makeup. Some things that you can expect after the treatment, I've kind of termed it tracking. Sometimes you can see kind of a little red dots or bruising, if you will. It looks like little tracks. It's really more common underneath the eyes, on the forehead where it's a little more bony. That might hang on 24 to 48 hours and that will subside. You'll be as red as you're going to be directly after the treatment, and it will subside quite a bit throughout the day. You will hang on to a little bit of redness for several days, which I like. I think it's just like a healthy glow.
Right.
I did mention you'll be heat sensitive, so when you're outside, you're going to feel the heat in your face. When you're in the shower, you're going to feel the heat in your face just like you have a sunburn. That's similar to how it feels.
Okay.
So you can cool your skin with whatever you want. After sun care, aloe vera, those are all nice and soothing topicals that you can use. Some people experience flaking. Not everybody experiences flaking, so that's not like an indication if you had a good treatment or not. It's just what kind of condition is your skin in and how aggressive was the treatment.
Okay.
I know a lot of my clients tend to flake in this area, but I'm really heavy-handed because most of my clients are coming in regards to skin laxity, facial aging, fine lines, and usually that's around the mouth where we get the most action. So I do multiple passes there, and I go as deep as my clients can tolerate, so typically that's where they're going to flake. You can moisturize that as much as you want. Typically, like if you have a peel, a lot of times your person giving you the treatment will tell you, let yourself peel, that's kind of the process you're wanting. Here, that's not necessary, so you can put on as much moisturizer as you want to alleviate that.
Okay.
Something uncommon, I suppose, would be swelling. That can occur. It's not very common, but it can, and usually it's right under the eye where the skin's a little more delicate and sensitive, and so if you do have swelling, you can treat with any over-the-counter antihistamines like Benadryl or cortisone cream. And of course, call us if you think that it's excessive or not normal.